Title V of the Social Security Act provides grants to states and jurisdictions to improve the health of tens of millions of women and children annually, including children with special health care needs. The Title V Maternal and Child Health (MCH) Services Block Grant is administered by the HRSA's Maternal and Child Health Bureau. There are several legislative milestones that helped shape Title V as we know it today. In 1912, the Children's Bureau, the first federal agency within the U.S. government to focus exclusively on improving the lives of children and families, was created. In 1919, the White House Conference on Standards of Child Welfare created a comprehensive report outlining the needs of children. In 1921, the Shepard-Towner Maternity and Infancy Act was signed into law. It provided $1 million annually to state programs for mothers and babies. In 1935, Title V of the Social Security Act, now the longest-lasting public health law in United States history, was passed. In 1981, the Omnibus Reconciliation Act combined 7 programs into the Title V block grant administered by the HRSA. The Omnibus Reconciliation Act of 1989 stressed the importance of meeting coordination and accountability requirements for the Title V block grant and introduced stricter requirements for applications, spending, and reporting. 85% of Title V dollars are awarded through the Title V MCH Services Block Grant to States program. The purpose of this block grant is to create federal-state partnerships in all 59 states and jurisdictions to meet a wide range of diverse MCH needs and challenges. Throughout this presentation, the 59 states and jurisdictions will be referred to as states. The remaining 15% of Title V dollars goes to support research, training, genetic services, screening, and other MCH-related programs. This is meant to increase the capacity for service delivery at the local level and to foster comprehensive, integrated, community-level MCH service systems. The amount awarded to a state through the Title V MCH block grant is based on a legislative formula that considers a base amount in addition to the number of children in poverty in a state compared to the total number of children in poverty in the country. States must match every $4 of federal Title V funds that they receive by at least $3 of state and/or local funds. States must spend at least 30% of the federal Title V MCH block grant funds on preventive and primary care services for children and at least 30% on services for children with special health care needs. States may spend no more than 10% on administrative costs. States can use the remaining funds to support other MCH populations, such as pregnant women and mothers. There are several principles outlined in the Title V block grant guidance. First, services should be delivered within a public health service systems model that addresses the core functions of public health: assurance, assessment, and policy development. Second, all programs should be driven by data to achieve results. And third, programs should have strong family partnerships across all levels of program development, implementation, and quality improvement. Family partnership means patients, families, their representatives, and health professionals working together to improve health and healthcare. In 2020, Title V services reached about 93% of all pregnant women, 98% of all infants, and 60% of all children nationwide, which includes 50% of all children and youth with special health care needs. To address its MCH population needs, Title V programs provide 3 levels of service. Direct services are preventive, primary, or specialty clinical services to pregnant women and children, including children with special health care needs. Enabling services are non-clinical services that enable individuals to access health care and improve health outcomes such as transportation and health education for families. And public health services and systems are activities and infrastructure to carry out the core public health functions of assessment, policy development, and assurance, meaning getting the right services to the right people at the right time. The Title V MCH block grant carries certain legislative requirements with it. One of these is that states are required to conduct a comprehensive, statewide needs assessment every 5 years. To do this, states analyze data and consult with partners, including families, to understand their own MCH population's demographics and emerging needs. These priority needs reveal where states will focus their attention for the next 5 years. States are also required to use performance measures to track progress on their priority needs. States identify the best combination of national and state performance measures to use. For the national performance measures, states use the National Performance Measure Framework, which is divided into 3 types of measures. National outcome measures are long-term indicators of population health status that Title V looks to improve. National performance measures are medium-term indicators that monitor health behaviors or healthcare access or quality, which Title V can modify. There are 15 national performance measures for states to use. Evidence-based or informed strategy measures are short-term indicators designed to impact the national performance measures through the state Title V program and its investments. In addition to the national performance measures, states may also develop their own state performance measures. Building on the needs assessment and identified priorities and using the performance measure framework, states develop a 5-year state action plan to link strategies to program priorities and performance measures. This approach helps states communicate and monitor their progress in addressing MCH priority needs. The State Action Plan covers 5 MCH population domains: women and maternal health, perinatal and infant health, child health, adolescent health, and children with special health care needs. States must submit an application and annual report every year to request funds and discuss progress on addressing their MCH population needs. As part of this process, states may request technical assistance to better address challenges facing their populations. The publicly accessible Title V Information System, TVIS, at mchb.tvisdata.hrsa.gov posts financial, program, performance, and health indicator data reported by states in their applications and annual reports, as well as national Title V MCH block grant information. Learn more about Title V by visiting mchb.hrsa.gov.